Hi everyone, happy to see you again. I'm Jinsu. Let's continue to learn the unit of medication. In this session, we will learn intramuscular injection. It is abbreviated as IM. By the end of this session, you will be able to describe the general characteristics of intramuscular injection, compare the sites for intramuscular injection, and simulate the skills of intramuscular injection. In last session, Mrs. Wu explained the subcutaneous injection. Different from subcutaneous injections, IM is a technique used to deliver a medication deep into the muscles. Many medications and almost all injectable vaccines are delivered this way. Medication by injection into muscle tissue is absorbed more quickly than subcutaneous injection because of the greater blood supply to muscles. Muscles can also take a larger volume of fluid without being more discomfort than subcutaneous tissues. A major consideration in the administration of IM is the selection of a safe site located away from large blood vessels, nerves, and bone. Contraindications for using a specific site are tissue injury and the presence of nodules, lumps, tenderness, or other pathological conditions. Several body sites could be used for IM injections. The ventral gluteal site is the gluteal medius muscle which lies over the gluteus minimus. The ventral gluteal site is the preferred site for intramuscular injection because the area contains no large nerves or blood vessels and provides the greatest thickness of gluteal muscle. The vastus lateralis is commonly used for immunizations for children from infants through to toddlers. The muscle is thick and well developed. As shown in the picture, this muscle is located on the anterior lateral aspect of the thigh and extends from one hand's breadth above the knee to one hand's breadth below this greater trochanter. The middle third of the muscle is used for injection. The width of the muscle used extends from the middle line of the thigh to the midline of the outer thigh. Traditionally, the dorsal gluteal site was primarily used for intramuscular injection. However, this site is close to the sciatic nerve and the superior gluteal nerve and artery. In addition, drug absorption from the DG muscle may be slower than other sites, and this can lead to build-up of drugs in the tissues and the risk of overdose. In spite of this, many nurses continue to use it. In China, it is still a common site for IM. The deltoid muscle has a triangle shape and is easy to locate and access. The patient can be standing, sitting, or lying down. To locate the landmark for the deltoid muscle, you should expose the upper arm and find the acromion process by palpating the bony prominence. The injection site is in the middle of the deltoid muscle, about 2.5 to 5 cm below the acromion process. Now, let's see how to administer an IM at the dorsogluteal site. First, assessment. Before IM, assess the patient's symptoms, knowledge of the medication to be received, history of allergies, drug allergies, and types of allergic reactions. Compare medication administration record to patient response and to confirm the patient with 2 patient identifiers. Assess the site on the patient where the injection is to be given. Avoid any site that is bruised, tender, hard, swollen, inflamed, or scarred. Assess the appropriateness of the drug for the patient. Check the expiration date before administering medication. If the medication may affect the patient's vital signs, assess them before administration. Let's go through the implement step by step. First, verify doctor's orders and MAR according to the hospital's policy. Review medication information such as purpose, action, side effects, normal dose, rate of administration, time of onset, peak and duration. Clarify any inconsistencies between the doctor's orders and MAR. Assemble equipment. The necessary equipment for IM is shown in the photos. Non-sterile gloves, sterile cotton swab, syringes, needles, and sharps container. Remember, the syringe for IM is usually 2 to 5 milliliter syringe with 22 or 23 gauge, or number 6 or 7 needle in China. Perform hand hygiene. Prepare medication. Please look at the photos on the slide which show you how to prepare the medication from an ampoule step by step. Transfer medication to the patient's bedside carefully and keep the medication inside. Verify patient using 2 unique identifiers and compare to MAR. You can first check the name and identification number on the patient's wristband. Then ask the patient to state his or her name and birth date. Explain the procedure and the medication. Close the door to the room or pull the bedside curtain to provide patient privacy. Perform hand hygiene again. Put on gloves and prepare the patient in the correct position. Ensure a sharp disposal container is close by for disposal of need after administration. Locate correct site using landmark and clean area with antiseptic swab. Allow the site to dry completely. Place a clean swab between your 3rd and 4th fingers. Hold syringe between thumb and forefinger on dominant hand as if holding a pen. With non-dominant hand, hold the skin around the injection site. With the dominant hand, inject the needle quickly into the muscle at 90-degree angle using a steady and smooth motion. After the needle pierces the skin, use the thumb and forefinger of the non-dominant hand to hold the syringe. Aspirate for blood. If no blood appears, inject the medication slowly and steadily. If blood appears, discard the syringe and needle and prepare the medication again. Once medication is completely injected, remove the needle using a smooth, steady motion. Remove the needle at the same angle at which it was inserted. Cover injection site with sterile gauze using gentle pressure. Discard needle and syringe in appropriate sharper container. Discard supplies, remove gloves, and perform hand hygiene. Document the administration of the medication immediately after administration. Record each medication given on the order, including date, time, and the site of the administration. Assess patient's response to the medication after the appropriate time frame. The general considerations. When administering an IM, nurses should know that ongoing assessment is an important part of nursing care for both evaluation of patient response to administered medications and early detection of adverse effect. If an adverse effect is suspected, withhold further medication doses and notify the patient's primary healthcare provider. For the age consideration, remember the preferred IM site for infant is the vastus lateralis. For elderly, muscle mass atrophy as a person age. Take care to evaluate the patient's muscle mass and body composition. The nurse should choose appropriate site based on the patient's body composition. Okay, that's all for today. Thank you, and see you next time.